Doctors and nurses, what's the biggest screw-up you've seen on the job that directly led to someone's death and it could have been prevented? I know of a case on a special ward for immunosuppressed people. In this case, it was someone who had a bone marrow replacement for a rare hematological disease. She was recovering quite well. The ward had positive pressure, airlocks, and other safety measures. However, that didn't prevent family from sneaking in a pizza from the hospital restaurant without staff knowledge. The patient eventually died from an opportunistic infection because she had no immune system to speak of. Safety protocols have been updated since. Next story. My mother-in-law recently had to have her knee replaced. She is a retired ER nurse with over 40 years experience. She knows her crap. The day after surgery, she started physical therapy and suddenly became dizzy and very short of breath. First thing she said, "I'm having a pulmonary embolism." No one believed her and told her to just stop hyperventilating. Orthopedic surgeon came by and did nothing, even after she told him she was having a PE. Next day comes and she looks pale and has a mild fever and her saturation has dropped. They order a bunch of tests that cannot do anything to prove or exclude PE. She demands a consult from a specialist. He never saw her, spoke with her, or did anything. The consult was just on paper. Next day, a doctor she knew from her days as an ER nurse walks by. She calls out to him and tells him she thinks she's having a PE, but nobody believes her. He's a trauma surgeon specializing in cardiac care. He agrees and raises hell at the department. Finally, she gets the tests she needs. Turns out, yep, her lungs are full of embolisms. She could have died. She's home now and still recovering, but mad as hell. We don't live in a country where suing is useful, but she has filed complaints and an investigation was started. I can't think of a single thing more aggravating than being an expert in the medical field and people not believing you when you're saying something is happening, or at least not even looking to see if you might be right. That's crazy. You clearly have some idea of what's going on, right? Next story. I was a pharmacy tech and we had a pharmacist give oxycodone 30 milligrams to a woman who was supposed to be receiving oxycodone 10 milligrams. She was on the triad too of Xanax, Ambien, and Soma, as well as some Norco. Once we realized the mistake, we called and called her. Eventually sent the police to her apartment to make sure she was okay. She answered after a while and said she had been passed out for days. Her blood pressure was bottomed out and her PCP checked her into the hospital. Next story. A new hospital opened in my city and one of the first surgeries performed was a leg amputation. All went well, patient survived, and then the mistake was realized. The doctor amputated the wrong leg. He didn't die, but I can't imagine his quality of life improved. Hasn't happened again. Next story. I was shadowing at this vet clinic for a while and there was this one vet tech who was working a later shift. The actual vet goes home after all the appointments are done. This one dog came in and obviously had something blocking its windpipe because its tongue was blue from asphyxiation. Instead of calling for emergency help, she just checked in the dog to be boarded overnight for when the vet came in the morning. Of course, he ended up dying. She told me this on my first day there. It would be one thing if it were just a stupid mistake that she learned from and regretted about, but she actually talked about it like she wasn't in the wrong. And how is she supposed to know? And everyone just overreacted. Jesus. It was obvious that all the other techs couldn't stand her. The next time I came by, she was fired. You shouldn't be in the career of having live animals or people depend on you if you can't even recognize your own mistakes. Sheesh. Next story. My mother-in-law went in for pain in her right foot. She had a black sore. Every day for a month they told her she was imagining it, and it was her other foot. Finally, after almost a month of not being able to figure out what was wrong with her, the head doctor finally asked her why she even came in. At that point, for the 99th time, we told them it's her other foot, idiot. Finally, only then did they look at her other foot. She went from losing her big toe to her foot to her leg to both her legs. She's been in the hospital for a year and a half. We have nurses and doctors on record saying that they screwed up and should have started with her right foot from the beginning. She has had countless complications because of malpractice and crappy treatment as well. For instance, she was forced to sit in a dirty bedpan for almost a week. The hospital and organization in question are currently being sued for all they're worth. The family has tons of audio and visual recordings, testaments from people who treated her, etc. There's already been one head nurse fired over all of this. It's been a very trying and physically and mentally exhausting year and a half for my family and her family. My wife, it's her mother, has been hit incredibly hard by all this, as has her family, and everything has trickled down to me. I've gone through hell over and over again being everyone's support. I feel like I could sleep for a year and still be tired. Next story. I'm not a doctor or a nurse, but my grandma died because her nurses didn't care enough. She was in a nursing home because she had such severe Alzheimer's she couldn't do anything alone, and we couldn't afford to have a full-time at-home nurse for her. She had urinary tract infections many times because they only helped them shower once a week, and she didn't remember to do it alone. So we started helping her shower once a day, and it helped a lot. Anyhow, one time when we visited, she was really warm and tired. We told the nurses to check for UTI. One of them promised to do it, but well, she forgot. We called the next day and they promised to do it, and hey, they did it this time. But it took 4 days for the doctor to confirm if she had one and if they could start antibiotics. 4 days for a UTI test. When I had one, they told me the same evening what kind it was. My mom and dad called there every day, even went over, but the nurses were like, well, what can you do? Well, it got to my grandma's kidneys. She got transferred to a different hospital and then she passed away. She was too old to fight it anymore. We told what happened to the nurses in the hospital and they were absolutely shocked and angry. We are now suing the nurses and I believe the boss of that facility, so no one else dies because of their crappy attitude. By the way, we're not the only family who's complained about them, and I get it. It's hard to be a nurse. But I told this story to my friend who is a nurse and to my cousin's mom who is a doctor, and they both immediately told us to sue because they were neglecting her. Next story. I worked as a transport in the post-anesthesia care unit, where anyone who is put under goes post-surgery before being transported to a room. We received a post-op patient whose pulse ox was tanked, and no matter what the nursing staff and unit docs did, it just wouldn't come up to safe levels. It took an NA/CNA to point out that the oxygen tank on the bottom of the stretcher was the wrong color. Yeah, the OR staff had hooked up this guy to CO2 by mistake. Oxygen tanks were bright green, whereas carbon dioxide tanks were bright red or black. Pretty hard to miss. The only reason the guy lived was due to having a nasal cannula as opposed to the newer face masks they now use for some patients, so he was able to get enough ambient oxygen to not die. I don't know if he suffered any deficiencies, but I imagine his brain was affected to some degree. By the way, this happened in a major NC teaching hospital/trauma center. I feel like I read a comment somewhere that said that I pronounced cannula wrong or whatever. I promise, I just looked it up and said it how Google says to say it. Is there a different way? Cannula? I don't know, man. Next story. I used to work as a phlebotomist in my local hospital. There was a dialysis clinic in the building right next to it. Apparently, a woman went in for her dialysis appointment and they didn't get the tube inserted correctly. The technician walked away and didn't check on her for a while, and she bled out. They brought her over to the hospital and did CPR and tried to transfuse, but she was already cold. Next story. Not related to me, but there's a woman who got to hospital with her sister who was right about to give birth to twins. They refused to admit her because she didn't have money to pay for all the stuff. The pregnant woman was unable to normally give birth, so she needed a C-section. Her sister, in panic of her sister dying, tried to save the babies from the dying mother. Right in front of the hospital, she looked for some sharp object, I don't remember if it was a blade or knife, and in the whole panic of the world, cried for help and tried to C-section her sister. No one gave a crap. People surrounded the place and were happily filming the whole scene. I know the American healthcare system is pretty, dystopian in some ways, but am I crazy to say that this sounds too dystopian? Where it's like, this doesn't even sound like it could happen, right? I don't know if that's my brain refusing to believe that this sort of thing can happen, or if it really does just sound too unbelievable. Absolutely absurd what privatized healthcare will do. Next story. My grandfather's nursing home did not give him, Alzheimer patient, adequate supervision. He wandered out of the home into the late October cold in nothing but a t-shirt and wasn't found for some hours. He developed pneumonia and died within weeks. I assume he already had some infection that was exacerbated by the cold and turned into pneumonia, since you don't really catch it out of nowhere. I don't understand why my uncle, who's footing the bill for the home, didn't sue. I was only a year old at the time, though, so I could be missing details. He was a diabetic too, so he should have been a patient who needed frequent visits to check blood sugar and be fed, etc. Next story. My friend was in a mental hospital as a patient when she was about 13 years old. She got the completely wrong medication, and then her therapist asked her to not tell her mom. Also, when my cousin's grandma was in hospital, my cousin's mom, who is also a doctor there, started checking her medication while the nurse was giving them. They were completely wrong. They also wrote down, "Patient is in good health and uses the toilet alone." My cousin's grandma has been paralyzed from the waist down the last 40 years, and she didn't have a wheelchair there, let alone the energy to use it. She wasn't able to use the toilet alone. Who the hell wrote it to her chart? Nurses are so overworked, which leads to a lot of mistakes. Next story. So this was back when I was trying to become a pharmacist. The first step is to become a certified pharm tech, which required some clinical training. I was put in a warehouse/mail order pharmacy. It was me and a couple of other people's jobs to fill the prescriptions and to lay them out for the pharmacist to check. I figured since I wanted this job one day that I should just start practicing now, so I would follow behind the pharmacist and verify the medications were the correct dosage, type, etc. There were too many times to count that the pharmacist signed off on a script I caught a mistake on. Yeah, she didn't like me, and moved me to inventory for the remainder of my clinicals. Next story. Sorry, this story will be vague because my wife is the nurse, not me. Essentially, a man came in for a routine operation, I want to say a kidney stone removal. My wife worked second shift and had the man as a patient for a few days. Even met his daughters and spent some time talking with them. Even told me at the time she was touched by how loving the man and his family were. One night she came in and the man was not doing well and hadn't passed a stool since the surgery. She notified the doctors and made special mention of the patient's deteriorating condition to the nurse taking over at the end of her shift. She had a day off, and when she came in the next, she found out immediately the man had died. Apparently, the surgeon had nicked the man's bowels. As a result, his abdomen filled with waste and essentially poisoned him. She was absolutely devastated. She later found out that the same surgeon had made other mistakes in the past. Needless to say, she left that hospital as soon as possible and got a much lower-paying job in a doctor's office. She still wonders, all these years later, if there were anything she could have done, but she raised as many alarm bells as possible and followed all the necessary procedures. Damn, I could never be a nurse. In short, man came in for routine procedure, doctor nicked his bowels, and he died from his body filling with his own waste. Next story. I'm a pharmacy tech, but saved a patient's life by butting heads with the pharmacist, doctorate, and the prescriber, another doctorate. Patient was given an oddly written prescription. Looked like full B, but the strengths were all a little off. This pharmacist adjusted the prescription to regular full B without contacting the prescribing physician, which I wasn't okay with. We can't go changing written prescriptions. That's just how the laws work. I get nosy into the profile, and the patient is obviously in kidney failure and should not be getting a massive dose of folic acid. RPH doesn't care. I'm not even the undergrad. He's the PharmD. I refuse to dispense it. Tell him to leave a note for my head RPH if he doesn't like it. So he counts it and leaves said note, but then takes it upon himself to get the prescription changed illegally since there's a stink around it. Patient comes to pick up, caretaker of theirs, and I instruct them to not give tonight's dose. Double check with the doctor, the nephrologist, and my head RPH will call them in the morning. RPH McStupid throws a fit about me overstepping my bounds. Tries to get replacement for me to kick me out tonight. Big fight. Next day, my normal RPH calls the nephrologist, who freaks out and orders the prescription canceled. Apparently, the same prescriber had given the patient a sample of Fulby a few weeks prior, and it almost ended them. Put them back in the hospital when they had just gotten home. Had their PCP send their release forms and sent in this RX. She'd have been dead or hospitalized again if she started taking it. The PCP was just inept, and the floating RPH that night was too cocky to ever imagine listening to a tech. You know, I know people are human, so this won't be the case, but it really feels like medicine should be the one area where ego doesn't exist. I feel like as many second opinions as you can get is probably a good thing. If you're letting your ego get in the way of people living, you've got issues. Next story. I work in care, elderly and people with mental health issues, also learning disabilities, and the worst I've seen is someone trying to lift a larger lady off her wheelchair and into a normal chair. Now in care, we have several machines, hoists, and stand aids to help lift and move people. If I hadn't told him to stop and then check the lady's care plan and notes, not only would he have hurt her, but also his back. Next story. My father-in-law was a lawyer and used to talk about all the crazy cases he got. One of them was a family filing a wrongful death claim. Apparently, Grandpa had gone in for a pacemaker replacement and they left a bundle of wires in his chest from some monitors, and due to constant bodily fluid, they had started to corrode in his chest. By the time they realized their mistake, it was too late. They ended up getting like $8 million. Next story. I'm not a doctor or a nurse, but here's what happened to my best friend's mom. When we were about 10 or 11, her mom had bumped her leg real hard off a table and had a massive bruise. Her leg hurt for a while, and the doctor she went to told her it was just a bad bruise. She probably bruised the bone, etc., etc. A few days later, she was dead. Blood clot had formed at the bruise in her leg and traveled to her lung. Next story. Roommate's friend told me that when he was a kid, a classmate had to go to the ER on Halloween night because he had excruciating stomach pains, but the doctors dismissed it because they thought he just had too much candy. Ultimately, that's what the parents began thinking as well, so they went home. Next morning, his parents go to wake him up and find him dead. The cause? A burst appendix. Next story. My father, who was a mechanic, was telling me about his coworker going to the hospital for severe stomach pains. When they went in to see what was wrong, they used a camera of some sort. After investigating for a while, they went to pull the camera out and cut something they shouldn't have. He ended up dying later that week from internal bleeding. Next story. No one died, but I saw 2 cases working in personal care that bother me to this day. The first was a gentleman who had gone from being able to 100% take care of himself and to live independently to having a massive stroke and basically being bedridden. You could tell his mind was still there, but physically, he was 100% dependent on others. He couldn't speak or even get out of bed on his own. One day over the holidays, the healthcare aides decided to just leave him in bed because it was easier. He sat in his own filth for about 18 hours before his daughter came to visit him and discovered it. He was entirely aware, too. Can you imagine sitting in your own waste for hours, unable to call for help? His family transferred him to another facility shortly after, and I can't say I blame them. Another case was an elderly lady who cognitively wasn't all there, but was physically doing well and had a good quality of life. We had 2 doctors on staff who would come in and do checkups. Over time, a pretty obvious lump started appearing on this lady's shoulder. Her son was hounding the doctor to take a look at it because it looked like skin cancer, but the doc refused. Finally, the son confronted the doctor one day and begged the doctor to look at the lady's shoulder, and the doctor, according to the son, just rolled his eyes and said, "She's 90, what do you expect?" The son was distraught, and also started looking into putting his mother in another facility. I only worked there for a year, but those cases really made me think about what kind of care I expect for my own parents, and how to get it for them when they need it. It was a good personal care home, too. These 2 cases are not reflective of the norm. Just a few bad eggs not caring about the residents. Next story. Girl comes into the hospital with a non-stop bleeding from down there. The kind you only see when they're giving birth, only there's no baby. Where's the baby? The girl keeps saying there's no baby, etc. A nurse corners her and threatens to call the police on her unless she says where the baby is. So she relents and says they threw the baby out the car window while driving to the hospital. The nurse still calls the police. Something illegal and that she never could have even brought up in the first place. The girl ended up taking her own life. Next story. Last year, my aunt passed away from pancreatic cancer. 12 to 18 months prior, she went to her doc because she didn't feel right. My aunt was quite the train wreck medically. She once stepped off a 2-foot-high deck and broke her toe. Just lots of things like that. So doc says, she's fine. Go home, get rest. 3 months later, she comes back. Still doesn't feel right. Doc runs a full battery of tests and says, she's fine. Go home. A bit later, she goes back and is adamant that something is freaking wrong. At this point, you'd think she would have gotten another doctor, but this guy has been treating her for years. They were friends, had cookouts or some crap. So the doc runs some more tests just to shut her up, and pancreatic cancer. Dead within a few months. Bam. He admitted to her that he missed it during the first round of tests. Are you freaking kidding me? I asked if anyone was going to sue. No, he feels bad enough. Well, thank goodness he feels bad. Now you go sit in the corner and think about what you did. Surely OP is saying that last line to the doctor and not their aunt, right? Surely you're not telling your aunt with pancreatic cancer to go sit in the corner and think about what she did. Anyway, I thought this thread would be sadder than it was. I don't know, it was just mostly infuriating. Which, not a positive emotion, but I wasn't weeping, I guess. Anyway, that's the last story for today. I would like to thank you all so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.